You've likely heard about fentanyl on the news. It's a powerful opioid, often making headlines for its role in the ongoing opioid crisis. But fentanyl is more than just a dangerous drug. It's a complex substance, with legitimate medical uses and a devastating potential for harm. This essay aims to shed light on fentanyl, exploring its origins, its role in medicine, and its dangers when misused. We'll delve into its effects on the body, the alarming rise of fentanyl-related overdoses, and what we can do to combat this epidemic. Understanding fentanyl is crucial for everyone. Whether you're concerned about a loved one, curious about its effects, or simply want to be informed, this essay will equip you with the knowledge to navigate this complex issue. Join me as we unravel the intricacies of fentanyl and its impact on our world. Fentanyl is a synthetic opioid, meaning it's made in a laboratory. Unlike natural opioids derived from the opium poppy, fentanyl is entirely man-made, allowing for precise control over its chemical structure and potency. It was first developed in the 1960s as a painkiller and anesthetic. Dr. Paul Janssen, a Belgian chemist, is credited with its creation, aiming to provide a powerful pain relief option for patients undergoing surgery. While it shares similarities with other opioids like morphine and heroin, fentanyl stands out due to its incredible potency. This potency is what makes it both a medical marvel and a potential menace. Consider this. Fentanyl is 50 to 100 times stronger than morphine. This means that even a minuscule amount can produce the desired medical effects, but it also means the margin for error is extremely small. This means a tiny amount of fentanyl can have a significant impact on the body. Just a few milligrams can be the difference between pain relief and a fatal overdose. This potency makes it highly effective for managing severe pain, but it also makes it incredibly dangerous when misused. Medical professionals must handle it with extreme care, ensuring precise dosages to avoid accidental overdoses. Understanding the difference in potency between fentanyl and other opioids is crucial. This knowledge helps in both medical settings and in efforts to combat illegal use. It highlights why even small doses can be lethal, especially when laced into other drugs or taken without proper medical supervision. The risk of overdose is exponentially higher when users are unaware of the presence of fentanyl. In the wrong hands, fentanyl can be a weapon. Its high potency makes it a target for illegal drug manufacturers who mix it with other substances to increase their product's strength, often with deadly consequences. Its potency and availability have fueled a public health crisis, leading to a surge in overdoses and deaths. Communities around the world are grappling with the devastating impact of fentanyl, highlighting the urgent need for education, regulation, and support. Despite its dangers, fentanyl plays a crucial role in modern medicine. Its potency makes it invaluable for managing severe pain, particularly for patients battling cancer, recovering from major surgeries, or experiencing chronic pain conditions. When used correctly and under strict medical supervision, fentanyl provides effective pain relief, improving patients' quality of life. It's often administered in controlled settings like hospitals or through carefully calculated doses via patches or lozenges. Fentanyl's ability to provide rapid and effective pain relief makes it a vital tool for medical professionals. However, its use requires careful monitoring and dosage adjustments to ensure patient safety and minimize the risk of complications. The medical community recognizes the importance of responsible fentanyl prescription and administration. By carefully balancing its benefits and risks, medical professionals strive to utilize fentanyl's pain-relieving properties while mitigating its potential for harm. To understand fentanyl's effects, we need to look at how it interacts with our bodies. This interaction is a complex process that involves various systems and mechanisms within the human body. Like other opioids, fentanyl works by binding to specific receptors in the brain and spinal cord, known as opioid receptors. These receptors are part of a larger network that helps regulate pain and emotional responses. These receptors are involved in controlling pain, pleasure, and reward pathways. When activated, they can alter the perception of pain and create feelings of pleasure and well-being. When fentanyl binds to these receptors, it triggers a cascade of effects, including pain relief, relaxation, and euphoria. This is why fentanyl is often used in medical settings for severe pain management. However, it also suppresses vital functions like breathing and heart rate. This suppression can be dangerous, and is a major reason why fentanyl overdoses can be fatal. The intensity of these effects depends on the dose, the individual's tolerance, and how the drug is administered. For instance, Intravenous administration can lead to more immediate and intense effects compared to oral ingestion. While controlled doses in medical settings aim for pain relief, higher doses, especially in non-medical settings, can quickly lead to overdose. This is particularly concerning with illicit fentanyl, which can be much more potent than pharmaceutical-grade versions. Over time, repeated fentanyl use can lead to tolerance and dependence. Tolerance means that the body becomes accustomed to the drug, requiring higher doses to achieve the same effects. This means the body adapts to the drug, requiring higher doses to achieve the same effects, increasing the risk of overdose. Dependence can also lead to withdrawal symptoms when the drug is not taken. Understanding how fentanyl interacts with the body is crucial for comprehending its addictive potential and the importance of seeking professional help when dealing with fentanyl dependence. Professional treatment can provide the necessary support and resources to manage addiction and reduce the risk of overdose. Section 5. The dark side of fentanyl addiction, overdose, and the opioid crisis. While fentanyl has its place in medicine, its misuse has fueled a devastating public health crisis, the opioid epidemic. Originally developed for pain management in cancer patients, fentanyl is a synthetic opioid that is 50 to 100 times more potent than morphine. This potency makes it highly effective for medical use, but also incredibly dangerous when misused. The drug's potency, combined with its illegal production and distribution, has led to a surge in overdoses and deaths. Illicitly manufactured fentanyl is often mixed with other substances, making it even more lethal. This has overwhelmed emergency responders and law enforcement agencies who are on the front lines of this crisis. Fentanyl is often laced into other drugs like heroin, cocaine, and even counterfeit pills, making it difficult for users to know what they're ingesting. This clandestine mixing of fentanyl into other drugs has made the opioid crisis even more complex and deadly. This significantly increases the risk of accidental overdose, as even a tiny amount of fentanyl can be lethal. The margin for error is incredibly small, and many users are unaware of the presence of fentanyl in their drugs, leading to tragic consequences. The opioid crisis has ravaged communities across the country, leaving families shattered and healthcare systems overwhelmed. The emotional and financial toll on affected families is immense, and the strain on healthcare resources is unprecedented. Addressing this crisis requires a multifaceted approach, including increased access to addiction treatment, harm reduction strategies, and public awareness campaigns. These efforts must be coordinated at local, state, and national levels to be effective. This crisis highlights the urgent need for comprehensive solutions to address the root causes of addiction, reduce the stigma surrounding substance use disorder, and provide support for those struggling with fentanyl dependence. Only through a united and compassionate approach can we hope to turn the tide against this devastating epidemic. Section 6. Recognizing the signs when fentanyl turns deadly. Knowing the signs of a fentanyl overdose can be the difference between life and death. Due to its potency, an overdose can occur rapidly, often within minutes. Look for these warning signs: slowed or shallow breathing, confusion or disorientation, pinpoint pupils, which are very small pupils, loss of consciousness, and blue or gray discoloration of the lips and fingertips. If you suspect someone is overdosing on fentanyl, call 911 immediately. Don't be afraid to act. Your swift action could save a life. Section 7. Turning the tide: treatment and prevention in the face of overdose. The good news is that fentanyl overdose is preventable and treatable. Naloxone, commonly known as Narcan, is a medication that can rapidly reverse an opioid overdose. Naloxone is available as a nasal spray or injection and is increasingly accessible without a prescription in many communities. Knowing how to administer naloxone and having it readily available can be life-saving. Beyond immediate overdose reversal, addressing the underlying addiction is crucial. Treatment options include medication-assisted treatment, counseling, and support groups. Combating the fentanyl crisis requires a multi-pronged approach involving prevention, education, harm reduction, and readily available treatment options. Section 8. Knowledge is power: understanding fentanyl to save lives. We've covered a lot of ground, from fentanyl's medical uses to its role in the opioid crisis. The key takeaway is this: knowledge is power. Understanding fentanyl, its potency, its dangers, and the signs of overdose is crucial for everyone. This knowledge can help us make informed decisions, protect ourselves and our loved ones, and potentially save lives. Don't be afraid to have open and honest conversations about fentanyl and drug use. The more we talk about it, the less stigma there will be. and the more likely people are to seek help when they need it. Remember, addiction is not a moral failing, but a treatable medical condition. By increasing awareness and understanding, we can create a more compassionate and supportive environment for those struggling with opioid addiction. Section 9. Spreading the word. Your role in combating the opioid epidemic. You now have a deeper understanding of fentanyl and the complex challenges it presents. But this is just the beginning. The fight against the opioid epidemic requires collective action. Share this information with your friends, family, and community. Educate yourself about the resources available in your area, such as naloxone training and addiction treatment centers. Support organizations working on the front lines of the crisis. Advocate for policies that promote prevention, treatment, and harm reduction. Every voice, every action, no matter how small, contributes to the solution. Together, we can turn the tide against this epidemic and build a future where everyone can live a healthy, safe, and fulfilling life. Let's work together to make a difference.